How we doing?
Pat Gannon is fighting a war on two fronts.
Let's get that leg straight just a little bit right now.
One is the daily struggle against his son Patrick Jr.'s debilitating illness.
We're doing well.
The other is a frustrating battle to get him the care his family says he needs.
Hi, this is Pat Gannon.
I don't want to miss this therapy.
We're overwhelmed with fighting with the insurance companies.
I'm just so confused. A lot of it is calling people who were in the business of saying no. We don't want anything that we don't have coming. We don't want anything that he hasn't worked for his whole life. He had health insurance, and now when he needs it the most, we want just a chance.
The Gannons' odyssey through the American healthcare system began late one November night when their son was rushed to an emergency room.
Patrick was on a ventilator, and he was gravely ill. I immediately called Good Samaritan Hospital, San Jose, and I found the treating physician in the emergency room.
I thought the odds of a survival were very low. I really didn't expect him to make it.
Patrick Gannon Jr., an easygoing IT tech who was about to become a father at 41, had suffered a massive heart attack. Patrick had flatlined, was revived, and now was clinging to life.
He told me he was probably going to pass away.
The hospital was a 9-hour drive north.
I kept telling myself, this can't happen. He's going to be alive when we get there. He can't die before we get there.
The Gannons arrived to find Patrick in a coma with no brain function, but still alive.
Just about every device was hooked up to him. And when they opened his eyes to check his pupils, I saw a death mask there. So I knew it was bad.
The delicate work of keeping Patrick alive was underway. A team of emergency room specialists, surgeons, neurologists, cardiologists tended to him around the clock. No one was thinking about it at the time, but the several weeks of life-saving care came with an enormous price tag, $1 million and rising. But Patrick had insurance, and Blue Shield of California picked up most of the tab for his emergency treatment. Not only did he defy the odds and survive, he awoke from his coma and progressed better than expected.
He was eating and speaking, and had actually stood up on the bedside with two therapists at Good Samaritan Hospital.
I remember running back to the ICU after that, telling some of the ICU nurses, you need to go up and see Patrick because he's doing amazingly well.
But Patrick was far from out of the woods. The young man who once helped build houses for Habitat for Humanity would now need intensive and expensive rehabilitation to have a chance at a normal life. His hospital doctors wanted to move him to an acute rehab facility right away for a period of aggressive therapy.
The quicker we can get patients who are medically stable to an acute rehab facility, the better chance they have of making a neurologic and physical recovery.
Acute rehab would include intensive physical and brain therapy. But the insurer, Blue Shield, approved a less expensive treatment in what's called a skilled nursing facility. Skilled nursing would provide Patrick some therapy, but it would be less aggressive and would not include neurological rehab.
He needed to go to an advanced acute brain injury hospital.
And from that point forward, the Gannons would become frontline combatants in a war that plays itself out in homes, hospitals, and doctors' offices across America each day.
Most people say, I love my health insurance. That's because most people are healthy and they don't use their health insurance.
Regina Herzlinger is a Harvard Business School economist who has spent her career researching healthcare systems around the world. She says the American system is fraught with obstacles that most patients are unaware of until they need care the most. When you or someone you love gets sick, you assume that it's going to be you and your doctor who's going to make the decision about the course of your care.
Hardly so. If you talk to doctors, they say, I cannot practice medicine anymore because there's a third person at the table. It's the insurer.
The question of who decides what's best for a patient is an ongoing source of contention. Insurance companies and their maze of rules and regulations, delays and denials can wear down doctors, not to mention people in crisis. It's a system that can breed anger and distrust.
It's a battle, and it should not have to be a battle.
Tonight, families confront life and death decisions involving the people they love. This woman is fighting with her insurer while her husband waits for treatment that could extend his life.
This is urgent. We don't have time on our side. Make a decision. Why?
And this mother is demanding answers after the worst possible outcome.
Deny, deny, deny.
But it may not be that simple for the patient or the insurer.
What is covered? If something is questionable, if it's not standard medical care, those decisions are not black and white kinds of decisions.
As for the Gannons, Patrick Jr. had survived his heart attack, but the second battle was just beginning.
I had no idea what I was going to be in for.